We're now at skill 13.22, assisting with chest tube removal. Yay, we've saved another, guys. All right, this person gets to go home soon. But, you know, we're going to take out the chest tube. We're going to monitor him for a little while. All right, so we gather our equipment and our supplies. So what are our equipment and our supplies? We're going to need a stethoscope, okay? We're going to need clean gloves. We're going to need a garbage bag. We're going to need sterile gloves. And we're going to need a petroleum gauze and tape, okay? You may need some just regular gauze to put over the petroleum gauze as well, okay? So that's what you need. So we've gathered our equipment and our supplies, and we've performed wipes up. So we're going to prepare the client, okay? We're going to position him in a sideline or semi-fallow position with the chest tube site exposed, which we have done, okay? We're going to place, oh, that's another thing you need. You need a chocks or a pad, okay? So we're going to put that underneath the patient, okay? Why? Let's keep it clean, right? Okay, let's put that there. Got it? Okay, then we're going to instruct the client to hold the breath during the procedure. Not right now. We're not ready for him. But we're just going to start educating our client, okay? So, Mr. Smith, you're going to have to hold your breath when we're taking that chest tube out, okay? Do you understand that? What did I just tell you, Mr. Smith? Could you repeat that back to me? Okay. Verify that he understood that, okay? All right. So then we're going to prepare a sterile field and our supplies, okay? So we're going to have our gloves close, okay? We're going to open up the Vaseline, the petroleum dressing and have that ready, okay? Okay? All right. Now we're going to put on our clean gloves, and we're going to remove the dressing around the site. We're going to be careful that we don't just pull that tube out, okay? Because we're not ready for that yet. And we're not going to do it anyway, the physician is. So right at this moment, we're just going to get the site ready, okay? All right. So we're going to, first of all, this will probably be clamped because we'll be assessing how the patient does with breathing on their own. So this will be already clamped, okay? All right. So then we're going to try to remove this tape as well as we can, as easy as we can. Okay. Sometimes it takes a little bit of finagling. Okay. Sticks to your gloves. It sticks to everything that it's not supposed to. At this, you can use the chucks and put your tape right on that chucks. Okay. Let it stick to that. Right. Okay. So then we continue working on getting this tape off of there. Okay. If it won't come off, what can you do? You can just slide it down the tube like this. Okay, it's now off, right? The site is exposed. We should have a mask on, so you will have a mask as well because this is a sterile procedure. We want to keep it as sterile as possible. We're going to put a mask on, okay? We're going to remove our gloves, and we're going to perform hand hygiene, okay? At this point, we're going to apply our sterile gloves. Okay, I have my sterile gloves on, okay? I've assisted the client with breathing techniques, provide emotional support. So, Mr. Smith, it's going to be okay, really. Remember what I told you when the physician's taking it out. I want you to hold your breath, okay? All right, so the client is going to be doing breathing, and you're going to provide emotional support. So immediately apply the gauze and tape after the primary care provider removes the chest tube. So this is when you want to have your petroleum gauze ready, yes, and your the gauze itself, okay? I don't have any more with me, so we're just going to reuse this one. Okay, so you'll have the gauze ready, and you'll have the petroleum dressing on it, right? You'll have the petroleum dressing ready to go. You're sterile, okay? All right, so you got it on your gauze. The physician pulls out the tube and you immediately put that over it, okay? So you close off that hole. You don't want any bacteria or anything getting in. We want to cut that down as much as possible, okay? At this point, we could have had our tape hanging on the edge of our table and tape this into place, okay? So we're going to tape this into place. And my tape all boogered up on me. Okay, so now we've taped it into place. See that? Okay, we're going to remove all of our used equipment. Whoops. Hopefully it's not stuck to your chucks. Okay, remove all of our used equipment. Put it in the garbage. We're going to return the bed to the lowest height, and remove and discard our gloves and perform hand hygiene. We're going to assess the client's response to removal. How do we do that? We do vital signs every 15 minutes for 1 hour, and then as indicated. We're going to auscultate. We're going to listen to lung sounds every hour for 4 hours. Okay, and then we're going to observe for signs of pneumothorax. So the assessment is going to be all indicative of what your facility wants you to do. So you have to remember, you had to follow policies and procedure for your facility. And it will be spelled right out of how often you need to assess your patient after a chest tube removal, okay? You're going to document all relevant information, including the client's response and the assessment data. And then you also, the last thing you want to do is you want to make sure that you get a chest x-ray 1 to 2 hours after removal of the chest tube to make sure that everything is okay. All right? So that's it. That's skill 13.22, assisting with chest tube removal.